Hi, and welcome to another episode of inspirED. Today, we are going to be focusing on social media in medicine with a specific focus a little bit on oncology, since two of our guests are heavily rooted in that area. I was mentioning to the panel that I am a little starstruck, as many of you will be, in that we recognize these people for their impact on the natural platforms that we find ourselves scrolling through. And so I think you'll enjoy getting to see a peek behind what each one of them thought when they were establishing their platforms and how they have evolved with the way people have responded. So I'm joined, and I'm going to ask for each panelist to introduce themselves, give us a little bit about their organization, and then certainly end with telling us their handle, so that right up front, if you don't already follow them, you can go to Facebook or Twitter and begin to follow them right away. So I'd like to start with you, Dana, if you would. And this is all a living room conversation. That's how all of our podcasts are intended. So we go by first names. And I'd like to ask you, Dana, to introduce yourself and go through who you are and what your platform represents.
Sure, and thank you for that warm welcome. My name is Donna Coriel. I know that it looks like Dana, but it's actually pronounced Donna. And I am a board certified internist. And I've got a really long story that I always summarize for the sake of brevity of these shows. I basically, I discovered the power of the online many years ago when I took a step away from medicine. At that point, many career doors opened because of my dabbling online, because I sort of created something from nothing and was able to really leverage my presence. So I decided that I wanted to empower other physicians to do the same, because I had been able to do it, and because I saw this hole, this gap where healthcare should fit, and nobody was on it. Yeah. And so I created SoMeDocs. And SoMeDocs has been a thriving, growing community that has many goals. One is to connect physicians in order to network in free spaces, some of them private, some of them public. The second goal is to arm physicians with the tools to personally brand themselves online and succeed in whatever endpoint goal each physician has. And the third is to connect physicians with the general public, so that they can actually get to the endpoint goals if their target audience is the general public. Now, it's been amazing, and there's a lot of things that we've grown and we've done, and lots of spaces where we're active. But again, for the sake of simplicity, I'm going to stop there, except to say that I have since left clinical practice in order to do this full time. Yeah, because it's been so incredible, and because I really believe in the impact that I can have in fueling physicians to do this. So, and my handles are, personal brand is Dr. Coriel, DrCorriel, and my this venture, this company is SoMeDocs, SoMeDocs.
Fantastic, Dana. I came across your platform, and I love what it stands for. I love how it's grown organically, and now I love to hear that. I watch Shark Tank. And you always hear the panelists, the entrepreneurs, say to people, is this a hobby or is this a business? And I love that you've taken the route of saying, I kind of was rooted in this passion for medicine, but now my footprint can be so much more significant, and I'm going to follow this passion for the impact of social media in medicine. I think it's fantastic. I think you're fantastic, and I can't wait to keep going with the interview. Carol, I'd like to come to you, and I would like to say your title. I love your title. I think that all of us would strive for having a title like yours. So I'd like to ask you to introduce yourself, your title, and who you represent.
You bet. My name is Carol Bush, and I'm located on the Middle Coast here in Kansas, in the Midwest. And my title, Sarah, is Director of Impact and Innovation for the Susan G. Komen Kansas and Western Missouri affiliate, and I negotiated that title, and it came to me as a result of the years of social media, you know, I guess investment in building my network and the opportunities that healthcare social media have brought to me to be innovative and make a difference. So my handle on Twitter, and that's my primary network because I've been on Twitter for over 10 years. My handle is @thesocialnurse. And people started calling me that because I was discovering, as Donna related, the power of the online community. I knew as an oncology nurse when I discovered digital competencies that was going to change the way I practice as a nurse, and I better figure out how to leverage those tools because I wanted to meet patients where they were. So I actually use Twitter quite a bit in professional networking. So I've not only used it as building a professional network to connect with other oncology nurses, researchers, physicians for public policy and advocacy. I also used it for learning, live tweeting. I have a background in journalism, so I love live tweeting a clinical meeting of any size because the audience is not just at the meeting, and what an impact now that is making in light of COVID. So I'm also a crazy Mima. Yes, that's a hashtag in our family because that's what my grandkids call me. I'm an oncology nurse activist and now impact director. So very excited to be a part of this panel. Love connecting and learning how we all are using digital skills to be innovative in reaching patients and also affecting policy change and change just every day in our community.
It's really incredible. I mean, to know that, you started back when people were like, what is this, sharing pictures of cats and stuff. And now look at the power of what this means to medical communities, to all communities, but to medical communities, I think it's incredible. And Gil, that was a good transition because, Carol's talking about live tweeting meetings. Tell us a little bit about your organization. Give us your handle and what the organization represents.
Thank you very much. First of all, thank you very much for the invitation. It's really, it's an honor to be among this wonderful company. Indeed humbling. But my name is Gilbert Morgan. I'm originally from Texas. I live in Sweden. I've been here for about 9 years now. As you might imagine, being an American in Sweden, I look for any way to reach out to all of my friends and family back home. And even then, you kind of want to have a presence. So social media was that possibility for me to actually be able to connect to the United States and the rest of the world. Originally, when I started with social media, my handle is We Oncologist. I really wanted to just strengthen my medical oncology knowledge. And at the same time, I wanted to be able to provide medical oncology knowledge to anybody who was out there. And not because I felt like I was in a position to teach, it was more that I was in a position to share. So that's how I started. And maybe that was about 2.5 years ago. So 15 months ago, right before my first son was born, I had the idea that we could have a network of colleagues that could actually be able to kind of filter out all the oncology information that's coming out, because anybody that is involved with social media will tell you that it's sometimes overwhelming and it's very hard to tell what is impacting. So I gathered some of my, they're friends, but they're actually very good oncologists, and they have a great social media presence. And I think in the beginning we were about 10. So we started OncoAlert, and OncoAlert is a way, it's a working hashtag. And like I told my wife in the beginning, this could either be a big hit or I could just flop and go right into my face. And luckily, it was the first. So we have this working hashtag, which is OncoAlert, and our colleagues can use the hashtag to inform us of anything that they think it's practice changing through the use of the hashtag. And I'm always looking out for the hashtag. However, we have the OncoAlert faculty, and those are the core people that are inside OncoAlert. And those people are constantly putting out things that are coming out in oncology that are practice changing. So in the beginning, it was for colleagues, by colleagues, and not much has changed, even though we have nurses. That is very important to have our oncology nurses in there. It's very important to have our scientists, absolutely, all cred out to our nurses because they're amazing. And we have not only medical oncologists, it's radiation oncologists, surgical oncologists, medical oncologists, cancer researchers, because we want to give a nice 360 view of cancer. Not only that, we want to flatten out that conversation so that everybody partakes into the conversation. We actually, what happened was in ASCO a couple of years ago, now it was last year, we noticed that there was a paper by one of our OncoAlert colleagues, Lisa Bernstein, that actually showed that there was a decrease in the patient advocacy engagement. And that was a wake-up call for me. And that's where we came up with the decision that 10% of OncoAlert will always be patient advocates. And these are patient advocates that are really involved. So then we started getting, we wouldn't call ourselves a patient advocacy organization because we're not, we are an oncology network, but we are there to strengthen the voice of our patient advocates. And we are there to bring out the concerns and the issues that are needed into the oncology community. So thanks to our wonderful network, we have gotten the respect of our colleagues and they're listening. So what we have to do is we have to bring out what our patients have to say to our colleagues around the world. So that was the development of OncoAlert. And then with every passing Congress, thank our wonderful colleagues, because quite honestly, OncoAlert is nothing if it wasn't for the people out there that are supporting us. So thanks to every single one of them that is actively contributing. We have grown. We are starting educational initiatives. Right now, we're doing our second collaboration with the European Society for Medical Oncology. We are doing programs with the European School of Oncology. I'm in Europe, so it's very easy to have that contact along with other institutions. So we are very happy that we have really good people that want to work with us, and even in social media through wonderful organizations that also want to promote what we're trying to do. There is absolutely, we are completely pro bono. There is absolutely no money. I am a fully working physician. So I think all of us are. And I think that has been quite the impacting thing in the growth of OncoAlert, is that people realize that it's just like, well, it's somebody who has to go to the hospital just like me. So we're really happy that it's worked out this way.
I love it. And being in oncology medical education and a researcher by training myself, it's been such an incredible resource. So I thank you and all the people who have made it what it is. And I just look forward to see where it goes. Dana, you know, you're in a unique situation with this particular panel because you provide an umbrella. I mean, it's SOMI docs, it's not SOMI onc docs. So, you know, you're seeing this and probably thinking like there are so many avenues where you can connect what you've built with subspecialties so that really, you know, you see this like powerful engagement. I want you to talk to us a little bit about how you go from an idea to 25,000 followers and then where you see this growing as you've changed your career path really to promote.
Absolutely. And you've hit the nail on the head. That's exactly how I view SoMeDocs, as sort of this overarching brand that houses all of these individual superstars, right? So superstars like Dr. Morgan and superstars like nurses and everybody in the healthcare sphere that wants to make impact in their specific niche. So I don't know if it's just my generalist background, being an internist, or it's me just being really good at marketing or in communicating. I could tell you that it took me many years to really shape my goals and where I wanted to be. I did know originally that I wanted to impact healthcare positively because I saw things that were negative happening online. And I knew that it took healthcare professionals and the goodness and all the amazing things that we do to change that. And so I knew that that was the goal I strived to reach, but I needed to then pave the path. So in terms of getting there, it takes a long time and you're going to make mistakes. And I still live in a gray zone because it's not black or white. And getting to your endpoint goal is not simple. It's not like you just say, I want to go from A to Z and that's it. Like it happens, right? Because the world is constantly evolving and like algorithms change. It's not in your control. So if you're on Facebook and you're counting on Facebook to give you traction today, tomorrow Mark Zuckerberg can say that it works differently. He's in control of that. So for me, it was about starting to understand the online landscape, knowing what I can and cannot control, learning how to out-clever some of the algorithms that are out there, and then doing it successfully. And so what I strive to do in SoMeDocs is to take amazing ideas like Dr. Morgan's and like all the other doctors that I've been in touch with regularly, and I'm regularly in touch with them because of the networking spaces that I've created, is to pick out amazing ideas and to grow them into amazing, effective brands so that we can actually positively impact in our specific target niches. Yeah. Right? So Dr. Morgan may be doing something amazing in oncology, but then there's the cardiologists and there's the rheumatologists and there's the endocrinologists. And each and every one of them can have significant impact. So that's where I come into the table. Someone who's done it, someone who understands the landscape, someone who's also really good at communicating and marketing so that I can also create a space that can help you, the individual physician, to do it yourself. Because I'm looking and I'm listening to Dr. Morgan, and he had an amazing idea and was able to really bring it to fruition, right? Thanks to a lot of the traction that he was able to build. But not everyone has that. And some people are in different stages and they have different ways to make that idea explode. Yes. And that's what I want to do is I want to bring the tools which physicians can use at different stages of the blossoming of their idea.
Yes, I love it. I love it. It's so funny because when you think about, especially how doctors have kind of the origins of how doctors or healthcare providers, even, Carol talking about, the social nurse. In the beginning, it was a lot about kind of like an online bio, oh, this one-dimensional, let me make a name and get out there and like people will kind of recognize my brand. Right. But what it's turned into, and I love to see how all three of you have impacted this evolution in such different ways, is people are looking for sources of credible information. I mean, we are living at a time where there are conspiracy theories, there are politically powered messages, there are like all this stuff, and it's so noisy that sometimes the end user believes like either I can engage or I have to like shut up all social channels. But the reality is no, you can engage with the appropriate credible sources and then shut out all the rest of that negative noise. And I think it's just so incredible how each one of you have done this. Carol, I'm going to come to you because I feel like you represent the lion's share of patient engagement on this call. Mm-hmm. A doctor is very discerning. A healthcare provider is very discerning. You can read something and say, recently we've had, if you wear a mask, you can't breathe and you're going to suffocate and die. Well, a doctor would read that and say, that's not medically true. Like, we wear masks all day long and none of us are suffocating and dying. But patients who are not aware may read that and say, well, if I already have late stage lung cancer or something, I don't want to, cover my face and then suffocate and die. how do you cut through using your channels? How do you cut through so that you do become that credible source for patients, as Komen has and as you have in innovation and impact?
So one of the things when I have providers who are interested in leveraging social media and patients who say, hey, I want to meet people like me and have conversations on different social channels. But again, primarily my experiences are Twitter because that's where I've really invested my time. What we have in healthcare is, and I share with patients and providers alike, is a great way to find patient communities that share evidence-based and effective practice. They're trusted, they engage in research, as well as collaborating not only with OncoAlert, et cetera, but it actually is called the Healthcare Hashtag Project and it's run by our friends at Simpler, which is, I believe, SYMPLUR. Like one great thing is it's collecting data and conversations that are happening around hashtags. A hashtag is really a way that Twitter originally um, identified a way to organize the topical posts. And now it has, caught on like wildfire across all of our social platforms. But on the healthcare hashtag project, you can actually source your own patient community or down to a very specific topic. So for example, I love to guide patients to communities like breast cancer social media, ovarian cancer social media, and then one of the most welcoming communities when I first began getting involved in Twitter and figuring out what's a Twitter chat and how do people share information was my friends, the Palamed, so the palliative medicine docs across the globe. Very vibrant patient advocacy organization as well. So I love to use Twitter and specifically look for patient communities to hear do social listening. So this used to be something that I could tell right away. So I'm from Kansas, right? Rural communities. This reminded me of the old party line. So I'm almost 60. Okay. So when I was a kid in our area, everyone, didn't have a private phone. You had a party line. So it was a way that people could support one another and share information. So that reminded me very clearly of that. But it's a way that patients can ask questions, but also share evidence-based information. And through social listening, we as professionals can understand what the real concerns are. And right now in the lens of COVID and the pandemic, social listening is the way we are gathering evidence base, because I'm speaking a little bit to community health because across not just oncology, but all domains, we've seen screening rates
Yeah,
plummet.
yeah.
And that has some long-term impact as well as immediate financial impact. But one of the things that in our community health, when we're looking to increase mammography or get people back to the clinic, they have a lot of fears around, is it safe for me to go to the clinic, et cetera. So rather than, we can't do an outreach event, but we can listen and engage in conversation through Twitter chats or in-patient communities and understand what people's real fears are and then address those. In fact, some of my colleagues here in Kansas, through the Kansas Cancer Partnership, we've engaged in it's a crowdsourcing messaging collaboration called Get Back to Health. And this is a way we're all leveraging one another's content, but sharing how it is safe to go to the clinic and get your screening and all of the very strict cleanly, infection control measures that physicians, et cetera, are making. So those are just some like innovative ways I think that we can engage patients, but also help people, um, make a change.
Yeah, yeah, no, I think absolutely, and it does it does help when you're able to say, we're looking for evidence-based information, we're looking for information that we can source, so that what we kind of tell to the external community is you could take it to the bank. It's something that you feel is based in fact. Gil, I noticed recently that you kind of did a call to action for people to, and I love Onco Alert and the way you activate, you empower people to get out there in their own kind of tentacles of impact. You did a call to action for people to participate in this survey, in this initiative. I want you to talk a little bit about how you're moving from being a static source of information to also collecting information so that you can disseminate that among people so that they can watch things like trends.
First of all, thank you very much. Those are incredibly nice words. And quite honestly, it's the best kind of feedback one could ever have, because this is the reason that we do this. There's absolutely no other goal. So I'm very fortunate that this has worked out the way it did. I think even though we would not like to admit it, a big part of this is luck. You have to be in the right place at the right time. It has to catch, and people have to believe you. And we were very, very lucky to have a wonderful faculty, but also colleagues that were open. And that actually led to us being able to get out there and put out messages. So because we have such a wonderful faculty, Onco Alert faculty, that they have a very well-established social media presence, not only a social media presence, but I mean, these are some oncologists, I mean, all of them are people that I look up to, and I have a personal relationship with each one of them. Everyone that is in Onco Alert, I personally looked them up and was looking at their tweets. Everyone has been vetted, if we'll put it that way, because you're forming a network. You have to make sure that what people are going to say and most importantly, what people are going to stand for. And you have to make sure that the people that are in there are in it for the right reasons. Like, for example, you were talking about the things with the coming out with messages with COVID and masks. I mean, we have Mark Lewis, we have Don Thiessen, that they do amazing stuff. I mean, these guys are superstars, and not only because they're good at social media, but they're just generally wonderful people and great oncologists. So when you have people like that, among many other people that are part of our Onco Alert faculty, going out there and putting this kind of information, for me, I mean, I don't do anything. It's already done, and these wonderful friends they believe in the message, they believe in the network, and then all the network does is amplify the great work that people are already doing. So this is nothing that Onco Alert is creating by itself. All we're doing is forming strength in that wonderful oncology network of colleagues that we have. And like I say always, by colleagues, I mean patient advocates, nurses, scientists, doctors, everyone working together. And I think that's a beautiful, beautiful part. Like you were asking about the transition, we're not really transitioning, we're just widening. When it comes down to Onco Alert, I will reveal my secret, which I went from the beginning. Nothing has changed. I don't plan, I adapt. So I see what is needed by our colleagues. So I constantly have to be, like, this is like being a Wall Street stockbroker and being in the ground all the time. Not being in an office, but you gotta be in the pit. Well, I'm in the pit all the time. Ask my wife and she will tell you. First thing in the morning, the first thing she says is put down your phone. Last thing is put down your phone. But it's what you need to do in order to understand what your colleagues need. And that's the only thing that I'm trying to do. And right now with the creation of like, for example, this last survey, what we're working with the ESMO Leaders Generation Program group, and working with ESMO, and it's just basically getting this group and that group and just getting together and say, all right, let's form something now. It's not just about let's report on something. It's like, well, now we can create. And there's a lot of really good examples that have developed that way. Like, for example, with right now with COVID, the CC19, like I remember the conversations about CCC19 happening in the back channels of OncoAlert, which is super exciting.
Yeah.
So it's like some really amazing things have come out of that wonderful interaction between colleagues. So I think it's something that is just evolving, and we will decide, depending on what our colleagues need, if we will continue that way or continue another way. My main thing, like I told you from the beginning, has been education. And it's basically because I thought that, I mean, coming from the US and right now I work in Sweden, I realized that there's a lot of colleagues out there that maybe do not have the same opportunities of getting the education that we get in Sweden or the United States. So my job, and what I decided as it would be my mission, is to take this possibility of having the education and putting it out there so it doesn't matter, regardless of geography, regardless of financial situation, everybody has the same right, the same possibility of having great oncology education. And that's where these wonderful OncoAlert faculty come in. And like I said, we were working with the European School of Oncology, and they have their faculty, and it's just putting people together, providing a service. And like I said, the best kind of reward is those wonderful words, walking around congresses and hearing, you know, we really love what you're doing, please don't stop. It's the best thing. And yeah, the worst thing, if you want to keep me going, it's just like,
no, I love it. I love it. And, you know, Dana, as Gil was talking, I wrote down, I don't plan, I adapt. First of all, I feel like there's not someone on the planet right now that is not in the mindset of planning has kind of gone out the window because, you know, everything is constantly changing. But as he was saying that, I was thinking for StomiDocs, it's a different concept because maybe what you're doing is tapping into those adapters. And you're saying, you know, as an umbrella organization, looking for opportunities to increase the footprint, to grow the network, to connect people in meaningful ways. I want to identify those adapters so that we're kind of this constant flow of innovation. And I wanted to ask you, maybe tell us a story of what one of the most impactful things you've seen to come out of StomiDocs has been, and then maybe a touch of what you might be planning for the future.
Absolutely. Wow. So much to cover there. I mean, first of all, what Dr. Morgan said, I totally identify with it because that's what I call my gray zone, is that I'm constantly adapting to what works versus what doesn't work. I call it taking 10 steps forward and 5 steps back. I've still made progress, even if I fail at certain things. But I'll leave that there. Yes, the adaptability portion of StomiDocs is what I love, is that we actually do give space for any physician at any stage of their online branding or their ideas, or, you know, anyone is welcome. What's vetted there is just that they're a physician. So again, different things with what Dr. Morgan's doing versus what I'm doing, and both of them are very valuable. They're just different. Meaning, for me, it's that you're a medical doctor. That means that you should be heard. And what I want to do is to help you tap into what is your strength and what can you do with that strength from an online branding perspective, right? That's completely different than saying this is an oncology based entity and we're going to vet oncologists to speak to everybody, versus me who's saying, physicians, let's empower ourselves. Every one of you is special and has something amazing that you can say. You may not even know what you're amazing at, but I'm going to help you. And StomiDocs is going to help you find your flavor. And I always say, I love saying, bam, that's your flavor. Like, you can literally find what you're good at. And it really doesn't even matter what stage you're at, because social media is the great equalizer. Like, sadly, and yet let's leverage that. Meaning, sadly, anybody can say anything. And that's how pseudoscience is birthed, right? But at the same time, we're medical doctors. So what we say actually should count where it comes to healthcare, because we've got medical degrees. And each of us is important. A student, whether it's pre-med or a trainee or it's a fellow or it's an attending, all of us have an important role as humans to connect, to make impact, and to do it cleverly and to do it impactfully. And so how can you channel your own strengths in doing that? Now, in terms of what SoMeDocs has birthed, in terms of like, there are so many. In fact, I only recently started realizing that I probably should collect testimonials from the doctors that have.
Yes.
Right. And so I'm starting, but we've got so many projects underway that it is in and of itself a big project, because so many doctors have been helped through SoMeDocs. We've got over 25,000 followers and growing. I'm on every single platform. I've done it slowly. I've done that purposely. I've decided to build very slowly so that organically I really build deep roots into the ground and have people really see that we're not just talking. This is not just talking on social media. There's actual like quality behind the content that SoMeDocs creates, and also what we stand for, that we want to empower individual physicians. And so I've done it slowly, and there's been incredible traction, but throughout that time, there's been amazing collaborations. I've seen physicians grow blogs that are amazing. I've seen influencers birthed. And influencers in a good way. Everyone thinks of influencer in such a bad way. Why? If we can influence with evidence-based medicine, why is influencing bad? We're influencing every day. We're in the office. We're influencing because we're telling people what to do. We're giving our advice. I'm an internist that was practicing. I was the patient's coach.
Yes.
I was talking about their health issues, and I was coaching them. I was telling them what I think together with what they've researched, because again, social media is here and it's here to stay. I'm not going to make that go away. How can I fit in to the landscape of today and positively influence in it?
Yes.
Right? Physicians are so traditional in our mindset, and we for so long said social media is bad. I'm not going to be in it.
Yeah.
But I realized that, well, why? Like everyone else is in it. I should be in it too.
Or there was a misconception of like what it was for. And I think that especially with the older population, Carol, to kind of complement a little what Dana was saying, but also take it a step further, that notion of, social media is here to stay. It's here to stay, and good for all that it's good for, and for the things that, are challenges including. But for instance, like my mom turned 73 this year, and with COVID, we don't see her the same amount. She doesn't see the grandkids the same amount. And so a couple of days ago, I get on my phone and I see you have a friend request from Sylvie Loudon, who's my mom. And I thought to myself, my mom is on Facebook? Like, it was so strange. But the reality is if you're not on it, you're missing something, because you can use it for some powerful things. So Carol, what do you say to someone who's apprehensive or thinks it's too overwhelming, or has, like Dana said, these misconceptions that what kind of tool it could be? What do you say to those people?
I just help people understand whether they're a patient or provider and have heard some of these, these fears or bad stories, is, you get out of it what you put into it. So just like every day when we're in conversation with our friends and neighbors, some people share information and are bullies, and other people follow evidence and lift one another up and connect for the positive. So I love what Donna is doing with SoMeDocs. I think of that as an incubator also. She's leveraging the positivity, but creating this incubator. So, I'm thinking all of these angel investors need to reach out to Donna, because there's some great businesses being built. But again, what I coach people also is to look at, when we've had this conversation about influencers, the people that you like, know, and trust. And you can build trust and relationships via social media. Also, when we're in business, a part of our marketing plan may be to be on multiple social media platforms, but I coach people when you're starting out, just pick one and get to know some of the ins and outs of that. And yes, the largest growing population of social media people, the age group, are 70 and over. My 85-year-old mom's on Facebook. She does Instagram. She was actually learned how to code back in the day. So, I think we typically think of our elderly as not social savvy, but they have everyone's got their smartphone, which is also a printing press.
Mhm.
It has democratized. Okay, so yes, uh, we can't always rely on the ethics of all reporters, right? But most people who are really ethical and focused on, as in the healthcare profession, evidence-based and the facts, you can connect with them, and they promote evidence-based information. But this is the modern day. This is the printing press.
Yeah,
So
I love that, Carol. Well, as we round out to the end of this, we've got 10 minutes left. I want to ask a personal question for each one of you. Gil, I'm going to start with you. Who inspires you on social media? Who's someone you follow on social media and you look to for inspiration and information?
Oh, that is definitely a tough one because quite honestly, uh, every single, I mean, not just people in OncoAlert. So I'm going to say everybody on OncoAlert
Yes.
to cast out a blanket statement. Tatiana Prowl has a lot of really good stuff. It's a very, very smart colleague. I love the way that she comments, and there's always something there. So she would be one of my top people that I would follow.
That's awesome. That's awesome. Thank you. I follow her too, so I know where you're coming from. Dana, what about you? Someone who inspires you on social media, who and why?
So I wouldn't single anyone out specifically, but I actually would say that the non-physicians are actually who inspire me, the people who literally are making social media active. I love that because I think that's who I have to learn from, right? It are the non-physicians, because I finally realized that networking for physicians, something we don't traditionally do, but when we embrace the power of networking and bringing in the experience of non-physicians, that's when we can actually grow and blossom as physicians and connect with the rest of the world that can make it happen. And so innovation starts from keeping your mind open and from looking at people that are not like you. So anyone who's not a physician, and of course my physicians, I love them the most too, but the non-physicians inspire me.
Yeah. And it's so funny because you think about, when you mentioned influencers, and Carol did too, influencers, what is wrong with influencers? It could be a makeup artist, it could be, a singer, it could be anybody who has something to say. And what you're saying really is like focusing on the trends of the consumer to listen to what do they want to hear. So you've got to match your message with, who's listening. And I love the way you're doing it in your network approach. But I absolutely agree that if we're not thinking about the end user, what are we doing? It's almost like we're just talking to each other. So yeah, I love that that's who inspires you. Carol, how about you? Who inspires you? Who and why?
okay, so definitely it's the patient community. I mean, a nurse, right? But in particular, I'm going to make a shout out to a woman I met who actually happens to had lived in my own backyard, but I met her on Twitter when she was a co-host for the Healthcare Leader Twitter chat, because I thought, oh, this is how you should learn about a Twitter chat. Join the largest one in the world, right? But here's the thing. She is also a cardiology nurse and a stage 4 anal cancer activist.
Wow.
And she motivates me now recently, unfortunately, she did pass away. She's a dear friend. I connected with her on Twitter. She lived in my backyard. We always followed one another, and she used her experience and story, began blogging, became an author, and then used her community and voice to change the way clinical trials were developed at 2 NCI designated cancer centers. And so just a big shout out to my good friend, Michelle Longabaugh, and her Twitter handle at Crazy Ass Cancer, because she's an anal cancer survivor. And through that blogging and Twitter, her activism lives on. So I'm using that to motivate me to take my voice and activism to the next level. And I think we can all, we can all do that through our colleagues and networks.
Yes, absolutely. And then, Gil, what do you think is the social, okay, let me start again. Not COVID-19. What do you think is the social media trend for 2020? The thing that people are going to be kind of looking at, following, and pushing through. Not COVID-19. That's a given. What's next?
Well, I'm going to kind of cheat a little bit because if it's non-COVID-19, there's pretty much nothing that is non-COVID-19. It has touched everything in our lives. So in that way, I'm going to cheat a little bit. But I think the one thing that is going to be the most important thing is education. Oncology, social education through social media, whether it be something that you that are constantly streamed or something that you log on. It's something that every single society, every single institution is going to have to invest in, because even though we might come back to the days where we were traveling and seeing each other, which were wonderful days, I think there is a very, very big part of us that will always stay virtual from now on, because we've seen what this can do. So we have to be ready next time. So I think the development, the really exciting stuff is going to be happening exactly in education. And for someone like me, who that's the reason I got into this is just icing on the cake. It's going to be wonderful.
For someone like me who owns a medical education company, I can get behind that social media trend.
It's going to be great.
Dana, how about you? Not COVID-19. What are you thinking is the trend in 2020?
Well, for me, it's probably individual empowerment. Whatever that topic is that you as a physician feel like you're strong at and brings you happiness, because those are the two factors that are really important to me. What are you good at, and what brings a smile on your face? What puts it on there when you wake up in the morning? That is where I want physicians to focus, so that they can literally build individual brands surrounding something that's both impactful and that they feel so passionate about that it's not a job, it's not work. That to me is the American dream and what I'm living currently. And I'd love to see that with individual physicians, so that again, we can impact healthcare positively.
Yeah, I love it. I love it. And Carol, what about for you? What's the social media trend for the year?
I think I see, because of the trend of education and the fact that people, are really thirsting for knowledge, and we know there's a lot of false news out there. I see a trend of more in terms of people understanding how to discern and understand what is credible, as well as all social media platforms, developing their own algorithm or rankings according to that. And I think there'll be a lot of interesting conversations and maybe some policy. It'll be interesting to see any policy implications that come out of that. But I think I see people understanding how to discern what is true from false in social media.
Yeah, no, definitely. Well, we're down to the end of the podcast. I want to say thank you to all of you. You inspire me. I'm not just saying that. I follow all of you. I start my day, Gil, probably with my husband saying the same thing, put down your phone, and I end my day with my kids. So, I myself, as well as my team, this podcast was invented out of needing to innovate when everything turned on its head for us, Alive Medical Education. company. So I follow each one of you. I'm inspired by the things that you all do. I love the way you speak your truth and you empower others to speak their truth, no matter what category they fall into. I celebrate with you as you reach milestones, because I know how hard it is on the back end. You know, we're all in building things, and I know how hard it is to wake up every morning and think ahead. What can I do that's going to make impact? What can I do that's going to bring my mission to fruition today? And I can tell you that, you know, what you're doing means something. It means something to the listener. It means something to the community, and it's going to mean something to the archive of information that we get to look back on. And each one of you shaped that archive, and I love to see it, and I'm so proud of you all, and I can't wait to see where each and every one of you go and grow this year and beyond. And I thank you so much for joining me today.
Thanks,
Thank you
Sarah,
so
and
much.
everyone.
Perfect. And happy birthday, little one, to Dana's family.
Oh,
Yes.
thank you so much. My
Happy
son's
birthday.
turning 15. Thank you.
Okay, perfect. Look forward to talking again soon.
Thank you very much for having us.